In January 2023, FDA approved Leqembi for the treatment of Alzheimer's disease via the FDA's Accelerated Approval Pathway. In this video, we'll talk about why Leqembi is different and how it qualified for the FDA's Accelerated Approval Pathway. The information provided in this video should not be used for diagnosing or treating a health problem. Consult your healthcare provider before making any changes to your health plan. First, a little bit about Alzheimer's disease. Alzheimer's disease is an irreversible, progressive brain disorder affecting more than 6.5 million Americans that slowly destroys memory and thinking skills, and eventually the ability to carry out simple tasks. While the specific causes of Alzheimer's are not fully known, it is characterized by changes in the brain, including amyloid beta plaques, as you see in the picture on the right, and neurofibrillary or tau tangles that result in loss of neurons and their connections. These changes affect a person's ability to remember and think. Leqembi was approved using the Accelerated Approval Pathway, under which the FDA may approve drugs for serious conditions where there is an unmet medical need, and a drug is shown to have an effect on a surrogate endpoint, for example, a laboratory measurement, radiographic image, physical sign, or other measure that is thought to predict a clinical benefit to patients. For Leqembi, the surrogate endpoint observed was the reduction of the amyloid beta plaque, a marker of Alzheimer's disease. However, the sponsor of the product must still complete clinical trials to show clinical benefit. The results of a phase 3 randomized controlled clinical trial to confirm Leqembi's clinical benefit has recently been reported, and the agency anticipates receiving that data soon. After this data is analyzed, the product approval status may change depending on the results. So for now, the product was approved based on the fact that it showed amyloid beta plaque reduction, but the end clinical benefit still needs to be confirmed by the sponsor. As part of the initial approval, researchers evaluated Leqembi's efficacy in a double-blind placebo-controlled parallel group dose-finding study of 856 patients with Alzheimer's disease. Treatment was initiated in patients with mild cognitive impairment or mild dementia stage of disease and confirmed presence of amyloid beta pathology. Patients receiving the treatment had significant dose and time-dependent reduction of amyloid beta plaque, with patients receiving the approved dose of Lecanemab, the active substance in Leqembi, 10 milligram per kilogram every 2 weeks, and having a statistically significant reduction in brain amyloid plaque from baseline to week 79 compared to the placebo arm, as you can see in this image. These results supported the accelerated approval of Leqembi. Now a little bit about Leqembi. It is an immunoglobulin gamma-1 monoclonal antibody directed against aggregated soluble and insoluble forms of amyloid beta. Leqembi reduces amyloid beta plaques and is the first approved drug to do so. Other drugs such as cholinesterase inhibitors and memantine can only temporarily ease some symptoms of Alzheimer's disease but not affect the underlying disease process. As specified in the prescribing information, Leqembi is indicated for the treatment of Alzheimer's disease, but the labeling does say that the treatment with Leqembi should be initiated in patients with mild cognitive impairment or mild dementia stage of disease, the population in which treatment was studied in clinical trials. The labeling also states that there are no safety or effectiveness data on initiating treatment at earlier or later stages of the disease than what was studied. It is administered as an intravenous infusion once every 2 weeks. Patients should be aware of some of the risks associated with the product. One is amyloid-related imaging abnormalities, or known as ARIA, which commonly presents as swelling in certain areas of the brain, and other infusion-related reactions may also occur. Other common adverse reactions includes headache. For full prescribing information, refer to the approved product label on the FDA site. Remember to subscribe, like, and share this video. I hope you found it useful and informational. And if you have any ideas for other videos you'd like to see, please do put it in the chat. Thank you.